country, so Headspace would like to acknowledge Aboriginal and Torres Strait Islander peoples as Australia's first people and traditional custodians. We value their cultures, identities and continuing connection to country, waters, kin and community. We pay our respects to elders past and present and are committed to making a positive contribution to the well-being of Aboriginal and Torres Strait Islander young people by providing services that are welcoming, safe and culturally appropriate and inclusive. We would also like to acknowledge and pay our respects to any First Nations people or Torres Strait Islander people that are here with us today. So next up, you're going to hear a little bit from me at the start. So next up is our amazing Progress Pride flag, which is painted on the forecourt of the Bendigo Town Hall. Hands up if you've seen it. Yes, it's pretty amazing. So this was done by the City of Greater Bendigo Council and was launched during our Pride Festival. And if you look closely, up on the red, you'll see me painting the town red in that photo. So this is where I'm going to wear my parent hat. And I am going to try and actually not read my cards, but I am a little bit nervous and I do want to make sure I get this right. So many years ago, working as a trainer and assessor for youth, I had the opportunity to sit in on a talk given by a trans person regarding aged care. I left that session thinking how challenging it would be as a trans person in the community. Little did I know I would be faced with these challenges 4 years later as a parent with my own teen. When I found out my teen identified as female, as parents we went through a roller coaster of emotions. We didn't know a great deal about the trans community, only what I had learnt in that one session, coming from a very small conservative town in New South Wales. I'd never heard of it. Then came the research and trying to navigate what we needed to do to support our daughter and her needs. I couldn't find anything at the time in Bendigo. I remember walking into Headspace Bendigo with tears in my eyes and asking for help. The manager at the time took me into her office and I spent time talking it all out. An appointment was made with Sasse. My daughter and I walked into that appointment not knowing what to expect. She was linked in with Headspace for mental health support. Our first appointment with Dr. Sasse at Headspace Bendigo gave us as parents hope. It really did. A referral was organised to the Royal Children's Hospital's Gender Clinic, and so our journey for my daughter and us as parents began. At the time, I started volunteering in the One Diversity group at Headspace Bendigo to learn everything I could from LGBTIQA+ young people and how I can best support my daughter on her journey to be her authentic self. And I can tell you now, I received many fantastic tips from that group. I volunteered one afternoon a week for 2 years, and while volunteering, I approached the manager about a parent-carer support group for parents and carers of trans and gender diverse young people, as there had to be more parents out there, not just me. This was the beginning of the parent support group at Headspace Bendigo. Our group meets monthly, face-to-face, in a safe and confidential space at Headspace. We come together for a coffee, a chat, tears, and we learn and hear from guest speakers. 3 years ago, we started the LGBTIQA+ Carers Project, a partnership with Bendigo Health Carer Gateway Support Services. This gives us the opportunity to provide our parents and carers with some respite and activities, and of course mental health support if needed. We know our young people are on a massive journey, but so are we as parents. Our parent carer group has now been running for nearly 7 years, with around 74 parents on our email list. We also do dinners once a month where we go out as parents and just enjoy each other's company as respite. I am and always will be a very proud mum. Next slide. So what we would like to do now is, before we introduce Andie, and Andie talks about their journey, we are going to show you a little video. Now, this video was put together with members from our older diversity group, and we asked the GPs and staff to send questions in for our young people to answer. And this great informative video was the result. Now, just bear in mind that the answers to these questions and the young people in this video, that are their responses. They may differ from young person to young person.
I'm Izzy. I use all pronouns.
My name is Angelique and I go by she, her.
I'm Lockie and I use he, him pronouns.
My name's Andie. I use they, them pronouns.
I mean, the GP that I had to begin with was our old family doctor, and I went to her originally because, I was 19 at the time and I didn't know how sort of else to start it, so I went and asked her, and she'd already had a previous transgender patient, so she basically just sent me along the sort of the same lines that she sent that person.
I think I've just gone to whatever GP and I've just found someone who's just good in general.
But when she retired, I had to find a new GP. So I think at the time it was mainly finding one that was close location-wise.
So once I moved, I wasn't quite sure what to do. I actually got a bit of help from my counsellor and from Headspace to get pointed in the right direction.
Well, I really just moved to Bendigo and got the first one that was available. And I've been meaning to look around a bit more for a different GP, because one that might be a bit easier to get into and stuff like that, and also so that I can make sure that we really get along.
The next thing was finding one that was obviously accepting of LGBTI and welcoming and all that sorts of stuff.
Preferably someone with a doctorate.
If I'm looking for someone who's accepting or who's LGBTQ friendly, I'll probably go on the internet. And I found that there's the GPs here at Headspace.
Looking for one who was knowledgeable with transgender issues.
Personally, is one, which I think that anyone would look for in a GP, is kind of that bit of doctor-client relationship. So there's that level of comfortability with them.
I'd be looking for someone that has had some training in LGBT issues and how to properly speak to people in the community.
I would say look for someone who's not going to make assumptions, I guess.
I'm someone that deals with awkward situations with humour, so that I feel a little bit less uncomfortable and it can be laughed about. So when I'm looking for my new GP, I would be looking for someone that can have a little bit of humour, take the edge off how awkward the situation can be.
It can be a little embarrassing and stuff, but I think at the end of the day, it's they're a doctor, they know it, they've seen it, and I kind of get that. Even if it's harder for me, I'll just prepare myself beforehand.
In all honesty, it's quite a struggle, and I struggle a lot with it. For me personally, growing up, I haven't been able to talk about a lot of different things. So, for me, it's been a kind of like a self-care thing to try and get myself to be able to talk more about certain things.
It is embarrassing for some people, and it is. And it can be nerve-wracking, but I just kind of prepare myself if I have to talk about it.
The GP you go to needs to be well informed of transgender and LGBTI health and all that sorts of stuff.
Try to be as understanding about how uncomfortable it can be for us. That if you're straight away asking, oh, when do you want to get your pap smear? When do you want to do these tests for breast cancer and STI checks and pregnancy tests, and is there any chance you're pregnant? It can make us feel quite uncomfortable, especially if we don't identify with those parts that you're talking about.
You can't always apply the same rules or questions to people who aren't cishet.
Don't make assumptions. That's pretty easy.
Well, when we're talking about body parts, it can be useful to ask the individual how they prefer to call it. If they prefer to call it something else, if they prefer to make it very scientific and leave it at that.
Seeking out information, getting training, as much training as you can.
Trust them as well, because they probably know a lot about their body or how they're feeling.
Being informed of some differences and even what people are and how important that is to their health.
Just because you've been a GP for 10 or whatever so many years, it's like there is still so much more information coming to light, and things that might not have been covered in the last time you did a session about it or anything.
Be open-minded, and if it's not for you, talking with those people, having those type of patience, then put it on the online. Tell people straight up. Make sure that you have the receptionist say that before they book an appointment with you, because they don't want you as their doctor either.
That unless they're removed, and they each have their own issues that can come along with them, and looking after their health is important.
Some people, might not struggle with it as much as others, but that doesn't mean that person might not ever need mental health support.
I've always believed in safety in numbers. It is a big thing. We are able to come together, and people who aren't out to their family can then feel like the support group is their family. I know I felt like that for a long time, that the support group that I go to is my family.
It's just something that if we spread more awareness, then more people can discover themselves earlier, or when they want to, or when they're ready, and they can feel safer.
So it's so important to have accessible support groups around. I think there should be one in every town.
Thank you so much. Now I'm going to introduce the star of our video, Andie, to talk about their reflection of using Headspace Bendigo.
Hello. As said, my name's Andie, and a reminder that I use they, them pronouns. So let's go on a journey. So when I first entered the Headspace building, I did not know what to expect, just like what happened with Maree and their daughter. So I was absolutely blown away that when I entered that building, I was immediately met with a receptionist that sat down with me to go through something that's called a happy survey. I'm not sure if they have them in a lot of places, but it's sort of to get an idea of how you're feeling before the appointment. And I had no idea what it all meant, so I was very glad to have the receptionist help me. And it made me feel like they were giving me that individual support and attention so that I could really get the most out of the Headspace experience. And during the appointment with the clinician, I was able to build a good rapport and gather all that necessary information that's needed to be able to work with someone long term. And I could go over my backstory and my goals and talk with them about what I want to achieve working with them, so that I knew what to expect from the process and things that I could expect, that it is expected of me. Sorry, I forgot my sentence. To form a game plan and be able to know what they're willing to do for me, which turned out to be a lot. Around this time, I also accessed the Frogs support group with Maree, and this helped to provide me a safe place to experiment with my identity and how I felt within myself. And it didn't take very long for me to discover what non-binary was, because coming from Echuca, I didn't know it was a thing. I think it's a lovely idea that I don't have to be either. And I think I came out in 2019. I don't actually remember. No, I started, 2019. Yeah. And I came out as Andie, and immediately it was put in the system. My name was changed to my preferred name, my pronouns, and everyone made such an effort, even if they weren't my clinician, but they knew, to just walk past and say, "Hi, Andie," and things like that. And that felt amazing, to be so supported as a queer person and have that experience coming from a rural area. And I also access the GP services with Headspace, and this has greatly lessened my anxiety, just like Bowie touched on, that it can be very anxiety provoking to seek help and talk about the health issues because you don't know what to expect. But since day dot with Chris here, I have felt so supported. I can talk about anything, we can make those jokes, and I'm glad to say that I've found my favourite GP I've ever met. And it has been an amazing experience because Chris is able to focus on the mental health side of things, but also be able to see through that and see what's happening in a physical side and see how they can both match up. Growing up queer, having physical health issues, they all go together. And she's able to just treat everything in a very holistic sense. And I think that's a very important role to have, not just for medication supervision, but also helping with those physical symptoms for everybody, because it happens a lot with mental health, that physical things arise. And it's also a safe place to talk about sexual health. Like, I know a few people that also see Chris that have felt very comfortable to say, "Oh, I have a new partner, I need to do a test." And I think also seeing Louise here, it takes a lot of the stress out of finding what you need as a queer person. And my last little part is that I'm going to be a bit of a sap here. I'm so grateful to Headspace and their employees for making such a safe environment to come to when we all need it. And it's all the opportunities as well that they've given me to help me grow as a person and find out who I can be when given the support that I actually need, and to have that recognised. And I am very glad that I could be up here today, thanks to Maree.
So yes, you're hearing from me again. I was fortunate enough to gain the position of Hay Diversity Worker at Headspace Bendigo. So what is Hay, or Healthy Equal Youth? It's a state government funded initiative to promote the mental health and wellbeing of LGBTIQA+ young people 12 to 25 years of age and help break down that stigma. So what do we do as a Hay partner? Quite a lot. Now there are 16 Hay partners around the state. Not all of those are Headspace centres. So we are very fortunate to receive that funding and to be able to do what we do with our young people. So we actually have our parent support group, which I spoke to you about before. Yes, that's still up and running, and we get a lot of inquiries from parents and carers around that group. We have our diversity groups. So yes, as Andie mentioned before, the frogs. So the frogs, yes, we do use it as an acronym too. Does anyone want to have a guess? No? Okay, full range of gender and sexuality. So that's our 18 to 25-year-olds. And then we have our tadpoles. Anyone want to have a go at the acronym on that one? No? Trans and diverse people openly loving everyone's sexuality.
When it was first brought up and we told the tadpoles that we decided they're called the tadpoles, a lot of them had a little bit of a hissy fit, which just made them more like tadpoles.
So that's for our 12 to 17-year-old young people. Both of our support groups are a safe and inclusive space where we actually encourage our young people to be their authentic selves. There is no judgment, there is no ridicule, no bullying. We do hold them in a very safe space for the young people. And it's an opportunity for them to meet other young people on a similar journey to themselves. A lot of the referrals come through from our clinicians or from Chris or from Louise, even schools, and a lot of word of mouth. So a young person finds their safe space and it's, you've got to come and join it. So some days we might have a massive group, but it's a lot of fun. We also do a lot of different events in the community, so acknowledging the days of significance on the calendar. We also do other events for our young people. So last year we actually took 16 LGBTIQA+ young people away on a queer camp for the very first time in Bendigo. We were really lucky because the camp facilities were donated to us along with all the food, and it provided our young people so many opportunities through art therapy sessions. We actually had the Commissioner for LGBTIQ+ communities, Todd Fernando, drive up on the Friday night just to have a dinner with us and campfire, yarn and sing along. S'mores with the Commissioner. So, things like that. We also do the Rainbow Ball. We know a lot of our young people don't get the opportunity to attend their social dances within schools. So we actually do one just for them with the support from Thorn Harbour Country, CERSH, Bendigo Community Health Services. We had a number of people on board for that one, and it was so much fun. Different events for Wear It Purple Day, Ida Hobbit Day. There is so much that we do for our LGBTIQA+ young people, and we do want to do a lot more. There's also, so I deliver information sessions, training sessions, information stalls as well. Also help out with referral pathways for young people, so they may not necessarily be connected with Headspace, but may need a referral pathway for them. There's just so much that I can keep talking, but I've got to stop, and everyone who knows me knows that I love to talk. So what I'm now going to do is actually pass over to Chris.
Some of what GPs do has been touched on, but I guess I wanted to point out that as part of the team, we provide continuity of care. We're able to, at Headspace, we're able to see young people whether they're linked up with mental health clinicians or not. So we are very involved with care coordination. Andy's already mentioned the importance of holistic care. We do a lot around family support and education and sitting in that room with parents. And then quoting Thorn Harbour training that I did last year, I love this phrase, we help with the spheres of affirmation. So my next slide sort of highlights some of the many areas that GPs can assist with. So we have, I guess this list comes out of the list of young people I've met over the years at Headspace, and the different ways we GPs at the centre have been able to help. As Bowie mentioned, hormones and surgery is the smallest part of what we are able to do, or referrals for that. But I'd also point out all the important things like physical health, sexual health, mental health, all the social support stuff, the advocacy with schools, other GPs, the interaction with NDIS, other mental health professionals, it just goes on and on. So depending on your centre, not every Headspace has a GP, but we're very keen to make that happen. That's one of our dreams at Headspace. And we would see that GPs have a really important role in that team. There's a little bit about legals too. We do help with that stat decks and stuff as well. So my list is probably incomplete, but I'm really happy to have questions at the end around what else we do. And I won't go through that list in great detail. You can read it there. And I'm going to hand on to Lou now.
I suppose in terms of a dedicated sexual health clinic at Headspace, Bendigo is quite unique, and it's an amazing privilege as a sexual health nurse practitioner to be able to work with this amazing team and the rest of the staff. So for a long time, the sexual health nurses at Bendigo Community Health Services worked with the GPs who work with young people prior to Headspace Bendigo commencing. And we've had a long-standing and trusted relationship with the GPs and continue to do so. So not only myself, but my other colleagues, who's Maree here today, we've really had the opportunity to work really closely with the GPs, and then of course with the other Headspace staff over the years. So not only to strengthen our knowledge and understanding, but also to work collaboratively with all the programs that Maree talked about, so that young people who come to Headspace or who are thinking about coming to Headspace or who we often refer to Headspace understand that it is actually a team effort and often feel really comfortable about that. But since commencing a dedicated clinic once a fortnight at the Headspace Bendigo, the trust and the strength of the referrals has increased. And that's got a lot to do with the presence of being there, but it's also got to do with the young people feeling really comfortable coming into a clinic that they might have had to access outside the Headspace service for sexual and reproductive health. And a young person said to me not long ago, you know, I'm really happy to come and talk about this stuff with you here because I feel really safe. And I think from what Louise said and what Andie said, safety is, paramount. So the sexual health clinic at Headspace is really based on youth-sensitive practice and how to best engage with young people. And this means that the young person is the centre of their care, as they are with all the care that the GPs provide. But it's also that often it's around education and information and not necessarily testing and treatment. And it's really allowing the young person to work out what choices they want to make for their own journey. However, some young people just use it as a clinic and they come in and they say, I want to test because they're concerned about something. And having that need met on that day is often really affirmative for that young person, that they can actually feel strong and content and positive that they've been able to achieve that. As we know, sexual health care varies greatly, and the purpose of the clinic is really just to complement the rest of the services that Headspace Bendigo GPs provide. So that may actually be being the person who does actually the hormone therapy on site. Privacy and confidentiality is paramount when engaging with young people, as we know. So when young people do come in with a parent or their partner or a friend, there's affirmation that it's important for them to feel confident that they can bring in an ally and that we can have a conversation with that trusted person in the room. But working from a youth-sensitive practice, we will always, at every consult, find an opportunity to talk to that young person on their own, just so that we both know that there's been all the opportunities for that young person to have their say that they might need to. We talk a lot about permission and consent working in healthcare, and particularly in sexual and reproductive healthcare, and they are the foundations of building a rapport with the young person. And therefore explaining how the clinic operates. What a nurse practitioner can actually do is actually quite mind-boggling for a young person who's only really had an interaction with a nurse or potentially a GP. But the important thing around permission and consent is actually checking in each time. The episode of care might mean 2 or 3 visits, and really ensuring that that permission and consent is given at each and every consult, just so that we can validate that young person is in charge of their journey. The clinic is flexible. We offer on-the-day appointments. They're long appointments, which is really useful to developing that relationship. Sometimes we do on-the-day procedures, like taking out an implant and putting another one in, so that that young person feels that they don't have to navigate a service somewhere else. Sometimes the nurse practitioner's role in the sexual health clinic is just to ensure the young people that it's okay, that it takes them a few goes to actually show up to the appointment, and that being there in the clinic is an opportunity for them to come in on the day that they're ready. There's been a lot of conversation around language. Sexual health, reproductive health language and terminology can be complicated, as we know. And it is important, as always, to check in with the young person about their preferred language. However, we do know as clinicians that sometimes we have to use anatomical names and physiological processes to actually correctly explain what's going on with the young person and to give them the information to make their choice, why a test is recommended or why a treatment is needed. So appropriate language that that young person feels safe to use and hearing is discussed right at the start of the consult so that we're all on the same page. The nurse practitioner in the clinic provides a whole broad range of services and additional tests and investigations that the GP may or may not have done. And there's communication between the sexual health nurse and the GP at Headspace complements each other, and so we check in with each other, and the consent in terms of that communication is important with the young person. We're very fortunate in Headspace Bendigo. We've got a wonderful site. The clinic rooms are very warm, they're very welcoming, they're colourful. Young people who come to the sexual health clinic who actually are not Headspace clients are just blown away by how comfortable the physical environment is. So running the sexual health clinic out of a GP room is very positive because often young people feel very safe in that space. We do encourage young people who come into the service to bring in support people, and our follow-ups are important in regards to how that young person prefers to be contacted. There is opportunities for the young person to have further sexual and reproductive health services at our sexual and reproductive health hub, which is in another location. And one of the great strengths of a sexual health nurse practitioner sitting in at Headspace is that we can actually facilitate the young person to feel confident and comfortable that they have to move across to another clinic for a procedure, that they will actually be received warmly and understood. And I suppose coming from a sexual health service into a Headspace, one of the most satisfying things is actually being able to contribute to the wellness of the young people who attend.